You are on a med-surg unit, assisting a patient with their dinner. They take a bite of food and immediately start coughing and sputtering. This diagram compares a healthy swallow to an impaired one. Usually, the airway protects itself, ensuring food follows a clear path down the esophagus. When neurological diseases alter brain function, this automatic protection fails. Here, the epiglottis, the flap that should cover the trachea, remains open, leaving the airway exposed to incoming food. In a neuro patient, a cough at the dinner table signals a breached airway. To understand why these patients lose their airway protection, we have to look past the throat and examine the brain. This brain illustration shows the substantia nigra. In Parkinson's disease, the loss of neurons in this area reduces dopamine production. This dopamine loss results in muscular rigidity. The patient physically loses the coordination needed to execute a safe swallow. Advanced dementia carries the same risk, but the mechanism shifts from motor to cognitive failure. As tau proteins accumulate and neurons die, the brain loses its maps. It cannot trigger the neurological sequencing required to initiate a swallow. Whether the cause is mechanical rigidity or cognitive decline, the result is the same. Food enters the lungs, causing aspiration pneumonia. Return to the bedside. The patient is coughing. The common instinct is to offer a sip of water to wash the food down. What is your next step? A. Give a sip of water. B. Lower the head of the bed. Or C. Stop the feeding entirely. You must stop the feeding entirely. Avoid the urge to grab medications or fluids. Follow the priority algorithm. Stop the feed, sit the patient fully upright, and assess airway clearance. Water only adds fluid to a compromised airway. Halting the process is the only way to secure the patient's immediate safety. Nursing exams test this by offering plausible distractors, such as calling the provider or changing the diet texture. These options ignore the priority rule. You must secure physical safety before implementing long-term dietary or medical solutions. Remember that coughing while eating indicates an airway problem, not a feeding problem. Airway always beats nutrition. Recognizing the neurological source of the failure leads you directly to the correct priority intervention.